call the Board of Health meeting to order for August 15th. The first thing on the agenda is citizen participation. Do I have anybody for citizen participation? All right, Steve? Looks like Steve Mitchell.
Hold on, just unmuting. So thank you. I've got a couple things on my list. Number one, the first thing is, I would say maybe 6 years ago, the select board got engaged with attempting to control the donation bins that populate, I think, all communities in Metro West. And what I'm observing is a lot of use of the donation bins as dump zones rather than as truly donation bins. Now, I understand that the building commissioner is really responsible for that. If you read the bylaw, is his responsibility. But I think there's a health-related component here. One of the problems is we can't ban donation bins, but we need to. I think we need to do a better job as a community to manage these things. Now, one of the components is that the landowner or the business owner accepts a donation bin. He allows a donation bin to be put on his property, which is fine. But I think that comes with some responsibility for kind of maintaining the health and safety of those situations. So I just wanted to bring that to your attention. I don't know if this is maybe there's some coordination between health department and the building commissioner and working to resolve some of these situations. But I think you're probably all aware or have witnessed these situations where people just leave piles of stuff next to these bins. And so I just wanted to bring that to your attention. It's probably not the most critical, important thing in the world at this point, but I think there is an element of public health involved here. So that's number one.
Just not to cut you off, Steve, but Raj, maybe you could check with the building inspector and see if that's something we can coordinate between him and us.
Absolutely, Mr. Berman. I know, and I've seen this all around. I'll have a conversation with him and look into what we can do about it. So definitely, yes.
Yeah, good. I appreciate that. And then the second thing on my list is, and I know that Jay is going to do a recap of the medical clinic from this past weekend. I'm not going to stay on the meeting, but I just want to acknowledge all of the work that members of the health department contributed to that medical clinic and the success of it. And I'm going to leave it to Jay to describe it. I think we all came away feeling it was a success and something that we were really I think pleased to be part of. But I really need to acknowledge Jay because he really, for like a year and a half, this guy just worked endlessly on this project. And I don't think it would have come anywhere near its level of success without his commitment and his leadership. And so I just want to acknowledge that. And it's not to diminish, all the other folks that worked on this in our local community group. Raj and Laura, Kristen French. We had a ton of Ashland people that were involved with this. But I just need to really acknowledge Jay and his efforts and work. So that's my tune tonight.
Thank you, Steve.
Yeah.
Agreed.
Thank you.
Thank you.
Agreed.
Yeah. Well done, Jay.
Yeah.
Steve, all the food was really, really good.
Yes, it was.
All the food was good. Well, I hope so. We spent enough money on food.
It was worth it. Thanks, Steve.
Good. All right. I'm going to leave you to your business. Have a good night. We'll talk to you soon.
Too.
Yeah. Thank you.
All right. Take care. Bye-bye.
Thank you.
Do I have anybody else for public comment? Okay, Mark, go ahead.
Thank you. Good evening, Mark Sony, 49 Hawthorne Road, SMS. I have a couple of questions. Can this town set up a all townwide health clinic to get percentages of ages of people, males, females, young, old. Can something like that be a percentage to be work on through the health department? That's one question.
Mark, you're asking how many males and how many females in town?
I'm looking for the answer on how to get that answer in a town graph form of percentage of how well this town is healthy. Like we did have the hot Ashland thing that went on years ago.
Yeah, Mark, I don't think there's any kind of data like that. You know, a lot of that's, people keep their health stuff private.
Okay, so that's one. And the other one is there any way of having health grants to help out the town with the comprehensive plan to get health businesses, health doctors and specialists in this town? Can there be any way, again, of grants for this?
I do know Raj and Laura are always looking for different grant opportunities, and some of them are very specific, but I know Raj and Laura, if they ever see anything that would meet the town's needs, they do apply for them.
And Mr. Berman, I can add, we have grants, but they're very specific. Like right now, we have a nursing grant from the MetaWest Foundation, that's just for nursing clinic, Then with the shared services, we have 3-4 grants, but they are very specific to topics, that we can address. But like, yes, we can look into if something fits there, But currently we have good amount of grants that at the health department that are specific, to the topics that we got the grants for.
Because I've been looking around on the computer to grant things to state and federal governments, or what they give out, and how it can help economically, health-wise, of the towns, cities, if they can coexist with grant payments that people can get them, and then fund for opportunities that the town can work on and work with the comprehensive plan to get a growing, expanded town other than what it is right now. That's it.
Thanks, Mark.
Thank you.
So the next thing on the agenda is the reorganization of the board. So I guess I will start off. Do I have a motion for anybody for chair of the Board of Health? Don't all chime in at once.
Anybody want to do it?
No, we have to know. I wanted to nominate somebody.
Go ahead.
I'd like to nominate Ed Berman as the chair for the Board of Health.
Do I have any other nominations?
Yep.
Anybody want to second that?
Well, wait, do you want to do it, Ed? Do you have enough time to do it?
Yeah. I mean, I can usually make most of the meetings.
Yeah, I mean, if I know Barbara made a motion, and I obviously respect that. If you feel like there's too much time, I certainly don't mind, doing it. If you, I'm just saying it. You have a lot more crap on your plate than I have stuff on my plate, but I was able to do it. So I'm just saying, if you have too much stuff and you would prefer not to, as long as the other board members are okay with it, I would be happy to take that off your plate. If you would prefer to do it, I do not want to rob you of that opportunity. I'm just offering. I'm not trying to upend Barbara's, but I know how busy you are, and I didn't want you to be a good guy and do it, and you're spread yourself thin anyway. So I'm just offering it, and that's also with the approval of the rest of the board too, because I've done it for 2 years in a row, and it would have to be a unanimous vote anyway. unlike if somebody had a runoff, it could be a 3-2. I would have to be unanimous.
Yeah.
Unless anybody else, and I just know how busy you are. That's it.
Actually, because Ron, I didn't even think to nominate you because I thought maybe you had a lot on your plate too, but
No, I
together.
know. Ed does more stuff in more towns
Yeah.
than I could even, and I respect, Ed's great. I would, anybody could do this, if they want, but,
And Ron,
I just know
honestly,
he's a good guy. And
Ron, if you want it, you've been the chair, and I would not mind being the vice chair, and then between the two of us,
I mean, I'm happy with that. I don't,
Yeah.
except Raj, how do we deal with Barbara's, nomination? If nobody seconded it, how do we
Well,
do it? I want to do it legally. I'm happy to
Yeah.
do it.
Well, like I
She can
said,
revise her motion.
I'm sorry, Laura, what did you say?
She can revise her motion,
Rescind it?
Okay.
Okay,
revise it, yeah.
all right.
So I can revise my motion
Good.
to nominate Ron as, Ron, so it would be Ron and Ed, right?
I'm sorry?
You'll just say Ron
Yeah.
first, and then we'll do the vice
Okay.
chair after. Thanks.
Okay, so, all right, I'd like to nominate Ron, to be the chairman for the Board of Health and Ed, the vice
Well,
president.
hang on, we gotta do one at a time.
Oh,
So,
one at a time. Okay,
yeah,
sorry.
and I'm gonna second Barbara's nomination of Ron of the chair. Any discussion on that? All in favor?
Hey, Dave and are you guys okay with that? I don't want to do this.
Absolutely.
Are you okay? Okay.
Yeah.
All right.
I am
Okay.
Ron. If you are, I know that you stepped down because you were very busy. At the same time, I know Ed
Yeah.
is too. I
Yeah.
personally
Yeah.
would worry about taking that since I am in between jobs and I cannot.
No, I completely, no, I'm okay. If I could swing it, last year, I could do it again, and I'd feel better about helping Ed out, to be honest with you. He did a ton of work on this. You did a ton of work on it as well, but at least it's a little something I can do. So. Okay, all right,
I
great.
appreciate that.
I just wanted to make sure you guys were okay with it.
All
Yeah,
right, so I
yeah,
think,
yeah.
and so
Okay.
I think
Okay.
we are unanimous, everyone?
Yeah.
I
All right, so
Okay.
now I need a
Okay.
nomination for
Yeah.
vice chair.
so
Good,
I guess
Barb,
I
you're on a
will.
roll. Barbara's on a roll. Go ahead.
Okay, go ahead, Barbara.
So, I would like to make a motion to nominate, Ed Berman as the vice president for the Board of Health for the Ashland.
Right. I'll second that.
Any discussion? All in favor?
Aye.
It's unanimous. And then
Okay.
Laura, do we still have the secretary seat or
Clerk, yeah.
clerk? Okay, so do I have a nomination for the clerk of the, we need a motion for the clerk of the Board of Health, and I would like to nominate David.
I'm happy to accept the nomination. I guess it would help at some point, maybe now. Just if someone could
To know exactly what it does.
So,
yeah,
so,
no, exactly.
So,
I think I have an idea, but
so
Yeah.
David, you have to
Would work.
spend 47 hours a week sitting with
Yeah.
Laura going through
Yeah.
documents.
Yes.
that's what I was afraid of.
Yeah.
Nothing against
does
Laura, of
everything.
course. It's more about the documents that are the
Yeah.
Yeah.
You don't even have to worry
Barbara
about that.
is the current.
Laura will do it. It means basically in this particular case that if I'm not there and Ed's not there, which would be exceedingly slim chances, that if there were a quorum between the three of you, Barbara, Jay, and you, that you would lead the meeting. That's basically what this means. The
All right.
chances of that happening are
Right, pretty slim.
exceedingly slim.
Yep.
Who is the
But-
clerk right now? Is it
Barbara.
I think it was Barbara,
Oh.
right?
Get it
Sorry,
Okay.
Barbara.
No, I'm just.
I
Um,
did, in my time as the clerk way back when, I did have to transcribe
yes.
one meeting that Laura was
That's
not there
right.
for.
I
Yep, and
remember
I still
that.
don't like her because of that, because she does a way better job.
No, you
It's
did
a
a
very
fine job.
difficult, it's
And
a
I
very
remember that.
difficult
That
thing to
was
do.
many
She
years
does an
ago.
amazing job with, getting things right and making them succinct. It's not easy. So, yeah, but she almost never misses one.
Sorry, Barbara. I thought Bernadette was.
That's okay.
Well, I'm certainly happy to accept the role, and I'd already kind of resolved to take better notes during the meetings anyway. So
Yeah.
I guess this will force me to keep that practice up.
All right.
All right. All in favor?
I'll second that if you're,
Oh, yeah, there we
if
go.
you're into that. Sure.
Just a
All in
second.
favor?
Okay.
All right.
Aye.
Aye.
Right.
All right.
Barbara, you get
Yay.
the year off. Next year
A
you're in.
reorg.
Yeah.
Ron, do you want to take over from here, or you want me to just
Sure,
keep
Ron.
going for now? Oh, I think he froze up.
Yeah, sure. Why not?
Okay.
Off my stand. Hang on. Okay. All right. I think Jay, you're up with the report from the event.
You're
I
muted,
think you're
Jay.
on mute.
Sorry.
Muted, Jay.
So first, I just want to thank the folks here for participating, and the people that were there over the weekend. And Barbara was there in triage on Sunday. Ron was there on both days in medical, and Ed was there, throughout, both in the clinic as well as over at the vaccine clinic. And I think, Ed, you said that you walked 7.5 miles on one of the days or something like that. So there was a lot of walking. So I know that there's going to be lots of time for thanking people. I think I kind of consider what we're in now phase 2, which is finding follow-up care for for many of the patients that we treated at the clinic, 90 odd patients, which is quite a bit. And I'll get into that. But anyway, I think it went really well. I don't want to take up a significant portion of this meeting with the clinic, because the fact is we still have at least 3 meetings, 3 debriefing or post-processing meetings to happen. And I'll keep, the board informed of all those. But what I did was I put together some stats that I pulled out from the RAM numbers, and I gave them to Laura. She shared them with all of you. And I kind of broke this up into service floor, but I'm just going to pull out, I think, some of the most important stuff. So it seems like we treated about 300 or 301, that number seems to be debated, patients in the clinic. Many of those got more than one service. So maybe they got dental and medical, or vision and medical. And I broke down the numbers per service below the totals. Also impressive were the number of volunteers that we had. We had on Friday for setup day 41 volunteers. That does include the people that came in from RAM, which are a combination of paid employees as well as the volunteers that work with RAM and travel to multiple clinics. But we had 151 volunteers on Saturday. That's, RAM, the 30 folks from RAM, plus 120 volunteers from the area and folks flying in from other places. And of course, this includes the professionals, the optometrists, dentists, and the medical staff, the doctors and nurses and such. On August 13th, Sunday, there were 112 volunteers that registered. I've got some service values in there. So RAM does monetize all of the services per CPT code, Medicare standards. They also monetize the volunteer value, or the so-called manpower or hours, hour value of the effort. So that's all in there as well. I've broken these numbers down into an average per patient. So for example, the average dental patient had a value of $425. For medical was $236 per patient, for vision $261. And these include the exams, any surgical procedures, laboratories, and things like that. For the vision service, we treated 157 patients, and we produce 140 pairs of glasses. Now, some of those, and I did have the numbers, but I didn't include them here, and I can't remember. Some of those glasses will be made on site at RAM headquarters and then mailed to patients, but the majority of these things were made at Keefe Tech in the vision lab and provided to patients right there on site, so they walked out with them. For the dental service, we had 77 patients over the course of the 2 days. And I didn't mention that Saturday was 6 a.m. to about 5 p.m. That was the duration of the clinic. And then on Sunday, it was 6 a.m. until about, I would say, 1 or 2 p.m. And that's kind of typical. It's sort of a half day on Sunday usually. So 77 dental patients. And I've listed the different procedures that they received here. And then for the medical service, I think this was probably the most surprising to everybody. We serviced 201 patients. We were, just to put it in perspective, I think we're expecting maybe 50 patients. So this is 4 times the number that we had expected. We could handle that volume because we had so many medical professionals. And again, I thank Ron for being there on both days. He had a few very interesting cases that he can talk about. The other thing that I should mention that is significant and not reflected here is that we, let me get back onto Zoom so I can see everybody. We reached our capacity very early on both days. So our dental capacity on, was it Saturday, I believe, was 60 patients, 60. So just as an example. When I left on Friday night at 11:30, there were already a few people in the parking lot. When I got back there at 4, there were 20 cars. At 4:30, when I came out with coffee into the parking lot, there were 30 cars. And from there, it just sort of exploded exponentially with cars in the parking lot. By 7:30, we had already registered the full 60 patients, 7:30 in the morning. Of course, they weren't in the building. They were registered and waiting outside to come in. And those patients weren't fully processed until about 5 o'clock in the afternoon when we finally shut down. So that was impressive. For vision, I think on Saturday, we hit the capacity about 10:30 or 11 in the morning. And for medical, it might have been by noon or something like that. So this just gives you an idea of what the need is out there, and also the promotion effort that went into this and how effective it was. And I, really want to give a shout out to Ed Hart for really putting just a huge amount of effort into this. He went everywhere to tell people about this clinic. And he was worried that people weren't going to show up, which is kind of funny. They showed up. They showed up both on foot, in cars, dropped off by Uber. It was, at one point in the parking lot, I was asking for more help because it was just sort of I won't say difficult to manage because we had an excellent crew in the parking lot, but it was more than I had expected. Were you going to say something, Ron, or somebody? No, that I heard something.
So Jay, I'm sorry, I do have to jump off in a couple minutes, but I just want to also thank everybody. We all just worked so great as a team. But what really got me most of the weekend was that we have such a need in our community that is so unmet. We could do this every day, and I still think we would, find problem areas. And then the other thing that we identified too, Jay, I just want to remind you that we probably have to work on, even as a health board, is the ability in Massachusetts is the only state we found out at this clinic where students are not allowed to work, even though their instructors are there, but they can do it at their school, which we could have seen so many more people if the students were allowed to practice.
Yeah, you're right, Ed, and that was one of the disappointing things about our clinic. There was such a need in the parking lot. We had to turn a lot of people away. So, and those were difficult conversations to have, even more difficult because you needed a translator involved. Most of the folks that came to see us did not speak English. And so that was really difficult. RAM, there wasn't really much they could do about that. With the number of providers we had was kind of what we had to deal with. But you're right. We had a dentist on site from Tufts, and that was one of the things he talked to us about. He's been to a lot of these everywhere in the United States, overseas, and he said that this is a real issue in Massachusetts. You have some of these laws that are sort of these legacy laws that prevent restrictions on reciprocity from out-of-state providers, as well as even in-state students and trainees doing certain procedures. And that also goes for optometry as well. So your point is well taken, Ed. We can talk more about that offline, I suppose. But I know you have to go. If anybody has any questions for me, again, I will update folks as we go through the debriefing process, where we're going to get information from RAM about what they think went right and what we could improve on, and we will provide them with feedback as well. And then now the next stage really is finding follow-up care for the folks that we've got. Why are we doing that? Because many of these patients have I think some serious conditions that we identified, fortunately, in the clinic, and most of them do not have primary care. So the effort now is in getting them signed up for health insurance, and or providing them with referral sources that will do a sliding scale for medical, dental, and vision. And Ron is going to play a big role in that. I really do appreciate it, Ron. And actually, I sent you a couple emails encrypted with some records and stuff like that. And we can talk more about that. But
no problem.
Happy to anybody else
just go on vacation and enjoy yourself. I'll take care of that.
Okay, thanks.
All right. Yeah.
And Raj, I didn't recognize you. Raj was there the entire time as well, and running back and forth to the vaccine clinics. Thank you very much.
My duty, sir. Thank you. I appreciate it. So.
Thank you.
That you set, Jay? Anybody
I'm all set.
Questions? Yeah. All set. Okay. Yeah. I'm just going to echo. Steve Mitchell's sentiments. I already told you off air, but you did an awesome job. That should really be recognized. You were the impetus to get everything going. You recruited a lot of help, but I agree with what he said. If you weren't running it, that you really made the whole thing come together. There's got to be somebody at the top leading everything, and that was you from start to end. So you helped a lot of people. And, we all helped you help a lot of people, which was nice, but, you started the whole thing, and it was a really great event. I made some friends that I think I'll have, for a long time. So, it was great to see all those people out there and people working together to help people that, need that care. So thank you.
Thanks, Ron. I appreciate it.
Yeah, you're welcome. Hey, Raj, just to follow up on that, I don't know if it's in your report. Do you have any numbers on the vaccine part of the clinic that that you did and Ashlyn did for everybody?
So, sir,
or is that in your report?
I guess the number was 35 from both the days.
Okay.
I guess that's what we got. But it's still a lot of it, given the complexity of administering childhood vaccines. For me, that's still a big number. So to accommodate that many kids or vaccines, so but that was the number I got. Correct, Dr. J? 35, right?
That's correct. And when I went over there, I finally got over there on Sunday. There were a number of Haitian families over there that apparently just arrived in Framingham, and they had organized rides for them to get those kids vaccinated. So that was, the timing was very good on that visit. And I did speak to the Framingham health director quite a bit, just about the need now in the area and stuff like that. And he really seems like a nice guy, and good to talk to. What was his name again, Raj?
Are you talking about the Framingham director?
Yeah, Framingham.
Uh,
I have his card, and we're gonna get in
Yes.
touch.
Mr. Murphy, William Murphy.
William Murphy, right? Okay.
Yeah. He did come to Framingham maybe like 4-5 months back. He was the director in Sudbury. Great guy, But only thing I want to add, I mean, we've been working on the vax clinic, the childhood vaccine clinic for a year and a half. I mean, you guys have seen the need firsthand here, so the vaccine clinic, the need is even more higher than what we have seen in this clinic, so that was one reason we have put a lot of resources, or time to get this clinic going, And the good news is Framingham is also trying to restart their clinic, that they've been doing for ages, but just some hurdles, but they should be starting their clinic soon. That was closed last year, because their public health nurse retired. So, but it's coming back together again, and hopefully we'll be able to take out this load, that we have in the community regarding the vaccines, So.
Raj, do you have any idea how many folks they signed up for health insurance over there at the Loring Arena? So just for those that don't know, in the same area of the Loring Arena, they running the vaccine clinic, Brace and the Latino Health Insurance Program were also over there signing people up for health insurance for Mass Health, as well as providing information and sign up for SNAP and other services. Any numbers on that? I didn't get any. So
no, I didn't either, sir. No. So,
Okay.
but we'll look into that, and probably next meeting we'll update the board. I will be in contact with them to get those numbers.
Yeah. Okay.
Thank you.
And Raj, just do we have enough resources to help cover Framingham, with their kids getting back to school with vaccines? They were good to us for a long time. So were you able to cover them this year with that?
Absolutely, Dr. Ron. We've been doing that. The last numbers we had, like maybe from 2-3 months, we have administered over 100 vaccines, to Framingham kids. I mean, we cannot cannot do what Framingham did it for us for all these years, given the resources we have. But we're just trying to do whatever a little bit we can on our end to help Framingham, and still, I mean, now also we're happy to take any Framingham kids, actively. But, we have limited resources, but we are trying to expand our clinic also. But I'm just glad, we are able to do our bit, just to take that load off.
That's really nice to, help those families and those kids out to be able to get them into school, to be vaccinated, to be able to do that. So that's great. Good work.
Thank you, sir.
Okay. All right. Raj, item 6, your agenda.
Yes, sir. So first thing, I just want to update you on the Chestnut Place Apartments. I know the management was in front of the board last meeting. A couple of good things, the sanitary situation at the dumpster have tremendously increased. They've been sending me pictures every week, so I'm happy with that. So they have made a lot of improvement there. About the whole housing cases, the one we had a bad housing at 13 Joint Drive number 4, the occupants have moved out since, and I got a confirmation from the management, and they'll be doing the work on the unit now. I'm still kind of struggling with the unit, where the roach problem was. What I got from management, this was like a couple of days back, that they still have issues getting access and all the pets, in the unit, so we still have to work on that situation that have not kind of resolved, but maybe next week or something, I'm gonna go out and do another re-inspection and see where the situation is. But it's like both-sided, they have some issues getting access to the unit, and all that stuff. So that is still pending, and I guess it came in the meeting, and I guess one of the management guys was in the office a couple of weeks back, we And then they're working on the pool application that we talked about that we didn't have for the season. They do have a semi-public pool on the property, and this year we didn't get the application, so I updated the board last time. About the second item, the part-time health nurse, we have extended an offer, and Kate Polander, she have accepted our offer, so she'll be joining the department on the 21st as our second part-time public health nurse. So Kate Polander have a lot of good credentials. She is going to be working as a school health nurse with the district of Dover and Sherburne. So she's going to be available to us every day after 3 o'clock. And so at least Wednesday, she'll be doing the clinic with us every week. So that's on the public health nurse. With our tobacco control program, the Framingham have hired a new tobacco control manager. His name is Mr. Parivalal, and he's settling down. I'm meeting with him tomorrow at 10 a.m. and then I'll bring him in front of the board, maybe next meeting or something, for him to be, on like that he can be agent to our board, as a tobacco control manager. So he joined like maybe last week or something, 2 weeks back, and we're meeting tomorrow just to go over our tobacco control. Both the beaches at the Hopkinton Park, Upper and Main beaches, and Ashland Beach is posted right now, so no swimming or recreational activities in the water. Might be getting results tomorrow, of the samples that was taken Friday, and I'll update the board if there are any changes. And similarly, the Washukum Pond is also posted right now for algal bloom, So most of our recreational water is posted as of now. Central Mosquito Control Program is still spraying, if any of the residents need any spraying for the mosquitoes. And given the rain, we do have 40 water samples that are positive for West Nile virus in the state so far. Fortunately, no human or animal cases of both EEE or West Nile so far in the season, and hopefully it stays the same, that nobody gets that, but the numbers are that right now. Like we don't have any cases of either West Nile or EEE right now.
That's amazing.
Yes, sir.
How does that work? That's amazing with how wet it's been.
That is correct, That. But given the water samples positive, we might see something, but hopefully not, but
okay.
For right now, it looks great.
Okay.
Thank you.
Yeah.
We did had another resident call for abandoned pool on Cedar Street. Did the inspection. We have issued an order, to correct. We is in touch with the owner of the property to get that mitigated. We did get that sprayed and the pool treated through the Central Mosquito Control Program. So that was done, and we're just waiting for the compliance from the property owner to cover the pool, and cut the vegetation on the property. Last item, the House Street landfill, we're looking for the contract. We did have few proposals now, that we are reviewing, and hopefully we'll extend that contract soon to somebody, to do the monitoring at House Street landfill. There are a couple of vendors that we have provided us with the quotes, and we're gonna look into that and get going. And I'm open for any questions for the board now.
Does the Central Mass Mosquito Control Project, is that something where they just go in and spray, or you have to request them?
So the major spraying, they do it beginning of the season, but now if you have to do it, you can request it. We can request it through our web pages or straight on the Central Mosquito Control Program. Like I did that for the Cedar Street property, right? We had an okay from the property owner that they can do it, and then we requested that, and they did it. They came out and do it.
Okay. So any, citizen of Ashland can make that request online or get a hold of you if they'd like to have that done to their property.
That is correct, sir. Yes.
Okay, all right, great. And how long does that run through? Like
I guess-
middle of September, end of September, till the first frost?
Yeah, I mean,
Okay.
the mosquitoes disappeared after the second hard frost. I can
Yeah.
check exactly like when they stop spraying, but I guess it takes 2 hard frosts,
Okay,
I guess under 32 degrees, for the mosquitoes to disappear or, completely die. But that I can check, with like when is the last spraying. So I'll shoot you any.
oh, no,
report
that's,
any emails.
yeah, I'm sure by the time it gets that cold, it's probably not much of an issue, but at least, for the rest of the, the summer or, beginning of September, it's nice to know that people can call them and if they're having an issue.
Right.
Yeah, thank you.
Thank you, sir. Yeah.
Okay. Anybody else? Barbara? Dave?
Raj, can you remind me, I know we've had problems with, I can't remember if it was Triple E or,
It was
forgive me,
Triple
the other
E
one.
a couple years
Yeah,
ago.
okay. Yeah.
Yeah, it was
At what
big.
point in the season, if that's going to be a problem, have we seen it become a problem? Is it by this time of the year?
That is correct, sir. So
Yeah.
with the positive samples, right? So how it works is initially the program, right? They do, or this is throughout Massachusetts, right? They have areas where they go sample water, right? Like, and that's what I was mentioning, that there are 40 positive samples so far in the state of Massachusetts, right? And given
Right,
given
yep.
those positive samples, we know the West Nile virus is out there, that there
Sure.
definitely can be activity given the season is still on, right? So that's what they predict and what they want to do, to mitigate the situation, So given a lot of rains this time, I'm glad, we have not seen anything, but like it's still early, So I will encourage the residents to take all caution, wearing long sleeves, apply repellents and all that, and be not out, but during the evening hours or late evening hours, right? And if you have any standing water, just dump it. That's one of the major causes, of mosquito growth. Because the mosquito grow only in standing water, no running water. They won't be able to grow in a flowing water. So if you have that on your property, you definitely want to get rid of it, because both of these viruses, right, the West Nile, and Triple E, they're very bad. Like I've seen a resident in Watertown when I was there, who got West Nile virus, and it was bad given, the neurological effects it'll have, So I met that resident, I was out for inspection, and he was not able to walk, so it was bad, So we definitely
yeah.
want to take all caution given the severity of the disease, so.
Absolutely.
But yes, it's still early, to say, and hopefully we don't have anything,
Yep. And I assume that the closure is due to the bacterial levels. That probably also has to do with the rain, probably washing pollutants into the water, or.
That is correct, so,
Yep.
Multiple causes, one of the major causes is the fluctuation in temperature that causes the bacteria to grow, that if it is fluctuating a lot.
Okay.
For both of the our beaches, I guess it's like 70,000 cells, that's the minimum, that the max they can
Yep.
have, the numbers were still over that 70,000 mark that we had in our reports, and they, I guess, do 2 samples in a week, and you need to have 2 negative samples to open
Right.
the beach back for recreational purposes,
Yep. Yeah, I just didn't know if it was worth trying to educate the community on the, the importance of like picking up after your dog if you're walking them at the state park, as I know many people do, and how that can, affect the water when there's so much runoff from rain and so forth.
100%. So, those are the causes, that we have, like, use of fertilizers, sanitary situations, yes, that causes this bacteria to grow.
Okay, thanks.
Thank you.
All right. Thanks, Dave. All right. All right, Raj, I'm giving you 2 weeks off, okay? All right. Well,
I
all right,
will
so,
take it any days,
okay.
I feel I'm still a little jet lagged, right? But like,
Yeah.
I wish I was able to devote more time to the clinic, but
Raj,
I tried.
every time I looked, you were there. So
Raj,
I tried my
I don't know
best.
how
you were
you
there
could
the
have.
whole time, right?
Yeah.
Yeah, I don't know how you could devote any more time to it than everybody else was there. So, yeah.
Thank you.
So, all right. All right, we'll move along to the consent agenda. Anybody want to make a motion to pass that as is?
Yeah.
And
I will.
Yeah. Okay.
Yeah,
and
well-
just. Yeah,
Go
I'm
ahead,
sorry.
Ron.
No, just for me, since I wasn't, when this says approved Board of Health draft meeting minutes, the only thing it doesn't say is for which meeting. If it's for last meeting, Laura, then I'm just going to recuse myself just because I wasn't an active member, but
Sorry about that. Yeah, it
No,
should
that's
just,
okay. Is it for the last
it was
meeting?
just, it was the one with the joint meeting with the select board.
It's two. I think it was two
Okay.
meetings ago.
Okay, that's
or
that's
maybe
2
even-
meetings. Yeah. So I can't vote on
But
that
right, you
anyway,
weren't a
but the
member.
three of you can
Yep.
approve it for sure. As
Right.
well
No,
as
it's you were there. This is July 12th. This was so you were there,
yeah, but
right?
I wasn't technically.
Oh, right. That's right.
I wasn't technically sworn in yet,
Right.
even though
No.
yeah. So
Okay.
So there's
even
four
though I
of us.
was there, but yeah.
Mhm.
But the four, yeah. So the three of you can approve that. That'll be a good vote.
Okay.
So-
So I'll make the motion.
Anybody want to make?
Yeah, I'll do it. Make the motion to
Okay.
to pass the consent agenda as is.
Okay. Great. Anybody second that?
I'll say.
Okay, great. Barbara seconds. Any discussions or comments? No? Okay, all in favor? Oh, I can't vote. The three of you can vote? Okay, terrific. All right, that passes 3-0. All right. I don't know if anybody has anything, that they'd like to discuss. I guess the next few meetings in September are the 5th and the 19th. So we can get back into our regular thing. And Raj, are we still, and Laura, as far as you know, are we still going to go remote? Are we going in person? What are we doing?
That's the board's call. So, whatever way
Okay.
the board is comfortable, we'll go accordingly.
Okay.
One thing I
yeah,
want to
well-
mention, sorry.
Yeah. No, go ahead.
Uh,
I'm sorry.
Just for the discussion, we might have a septic variance situation. I'm currently
Okay.
reviewing the plans, this is on Stobus Lane.
Okay.
That I was looking at the plans even today, there's some revisions we need for the engineer to do. Once we have that back, I'll be in touch with the board, if in case we need to do that before September 5th, but
Okay.
next meeting.
Yeah, that's it. All right. So even if 3 of us can get together to do that, that's fine as well, right?
Yes, sir. But
If
there
you
are
need us.
revisions, yes, thank you.
Yeah. Okay. All right. We'll make it work if you need us.
Yeah,
Okay.
and I'll just say, if we are thinking about whether it's going to be in person or by Zoom, I would not object to being in person. And I think that's probably easy for me to say. I mean, Ron, you are working, you're at your office, and
No, I mean, I
So-
can always make it. I just always stay here and do stuff anyway. So that, yeah, whichever way everybody wants to go, I'm happy to do it this way. I can be in person if people would like to be there. So so we'll wait and we'll talk to Ed about it. Rather have a full board so everybody can, get their opinion in and see which way they'd like to go. I want to make everybody comfortable. I'm okay either way as well.
Okay.
Okay. All right. All right. As always, anybody want to make the most important, call of the night? The
David
most
looks like-
important
David looks
motion,
like he wants
Barbara.
to make it.
I can tell
Yeah,
Barbara's on.
Okay.
Yeah, I can see.
I would like to make a motion to adjourn this meeting
Yeah.
at 6:52.
Okay, that's great. Thank you. Any seconds?
Second.
Seconds. All right. We got 2 seconds. That's great. I think that works. All in favor? Aye.
Aye.
Yeah. Mark, thanks for coming as usual. Everybody enjoy the rest of the summer, and
Too.
we'll be back at it on September 5th. Barbara, Laura, thank you rather, as
Thank
well as
you.
all the members. And, Jay again, and Raj, you're great to work with. Laura, I'm in for another year. Okay.
Thank you,
All
sir.
right.
Thank you for
Yeah,
doing
thank
that.
you.
Thank you, everybody.
Yeah,
Good
no
night,
problem.
everybody.
Good night.
Bye, everyone.
Take care. Good
See you,
night.
Dave.
Night.
Bye-bye.